you shouldn't directly jump to the diagnosis. First you should see that this is just a radiograph of a child. Mention about the heart borders, then you should mention about the lungs, that on the left side the lung is clear, but on the right side there is an air cavity which could be seen in the middle lobe of the lung. So this could be probably a case of pneumatocoel. Then if they ask what are the causes of pneumatocoel, then you can mention usually it is because of any cystic disease of lung, which is caused by staphylococcus or streptococcus, and it can also be seen in trauma. Next, this is a radiograph of a child, in which you should also mention about this stent which is kept, which you can see a long stent is there, right? You just mention that there is a stent. If you know the name of the stent, mention, or else just leave it, because they'll ask you about the types of stents and all, so don't go for that. Then the abdomen seems to be dilated, so it could be a case of ascites, and since you can see some gases in the abdomen, so this is pneumoperitoneum with ascites. This is chest radiograph PA view, showing lung. There is a cavity which is seen in the middle lobe, and on the left side the lung is clear, so on the right side it could be just a cavitary lesion. Again, chest x-ray, PAV and all, yeah, that you have to mention. Same thing. Then the heart of borders or aortic knuckle, whatever you can mention. Then normal findings, whatever you can mention. Then the right lung seems to be clear. With left side, in the upper lobe of lung, there is some opacity seen, which could be probably a case of consolidation of lung. Then you should be knowing all the causes of consolidation, the treatment of consolidation. They can ask you anything regarding that, but it's just 2.5 marks, so if you identify, that's more than enough. This is a radiograph which is showing the loops of intestine filled with air. See, you can see the loop of intestine which is filled with air. So what you can mention is this is a case of diaphragmatic hernia. What is diaphragmatic hernia? Although there is some defect in the diaphragm, the loops of intestine, they migrate in the thorax, and those loops can be seen in the thoracic region. So this is probably a case of diaphragmatic hernia, but you can end. This is again same thing, you have to mention. Starting you have to mention all the normal findings. Then coming to the left lung, the pleural space seems to be widened and opacified because of accumulation of fluid, so probably this is a case of pleural effusion. It is a chest radiograph which is showing in PA view, and it is showing the borders of heart, the aortic knuckle on the left side, but in the right side we could see some structure in the thorax, which could be a thymus in the newborn. And then they'll ask you at what age thymus get recessed, and what is the function of thymus. So thymus basically it helps in the immunity. But what is this? This is again same thing, you have to mention this is a radiograph which is showing which is showing thorax as well as abdomen, but on the left side of the lung it is totally white out, or you can say it is on the left side of the lung, the black field which is usually occupied by air is totally occupied, which is totally white out. So this occurs because of the opacification, total opacification. You can also call it as hemithorax. So what are the common causes? It is mostly total collapse, or it could be a massive pleural effusion, wherein the pleural space is totally obliterated because of pleural effusion. This is here you can again you go with the basic chest radiograph, which is taken in a PA view, and it is showing small granules which is spread out all over the lungs, So it is probably a case of miliary TB. Why it is called as miliary TB bole to the millets are like small granules, and this granules are compared with that of the millet size. Then they can ask you about the TB kit related everything, but it is just 2.5 marks. May you'll be asked 4 5 X-rays, so only identification is most important over here. Rickets may they can ask you many things. Rickets is like the most important thing. So they can ask you DD of rickets. So first go with this. This is radiograph showing two joints. That is, one is knee joint and one is ankle joint. Here you could in the knee joint you could see splaying, widening of the epiphyseal ends. And then there is one more x-ray, one more radiograph which is showing then again splaying, widening, and there is incomplete formation of metacarpal. Then they could ask you what is the DD, which is scurvy. In scurvy similar findings can be seen, but there are some other lines and all which you have to mention in scurvy which is not present over here.